Welcome to my presentation in which I'm going to outline a strategy to reduce work-related stress in the occupational therapy department. So first of all, what is stress? So stress is described as the adverse reaction people have to excessive pressures or other types of demand placed on them. A stressor is a physical, psychological or social force that puts real or perceived demands on the body or mind or emotions of a person. And stress occurs to an individual when a demand threatens to exceed their capabilities and resources for meeting that demand. So stress can affect different people working in the same environment as it is how the individuals perceive the demand and their capabilities to deal with it. So what causes stress in one individual may well motivate another. So the clinical features of stress. So the first things, the early signs to look out for, which may well be what you as a supervisor notice or what colleagues observe, are difficulty concentrating, unable to prioritise, the feelings of unable to cope, the reduced self-confidence, feelings of tensions and nervousness, and sleep difficulties. The physical features, which may well be indicated on sickness forms or may well be observed, are high blood pressure, chronic headaches, reduced immunity to infection, fatigue, muscle tension and gastroduodenal symptoms. Now, what are the causes of work-related stress? So there's three main areas which have been identified that cause work-related stress. And first of all, the environment is an important one. How the building is set out, the design of it, what the actual environment is the person works in, how their desk is set up, what their computer is like, and also what the lighting's like. Is it noisy or is it crowded? Also, the lack of control. So how and when people can complete their role, does this cause them stress? And also organisational policy. If there's not enough guidelines on the person's role, so for the managers to understand what they are needing to do or what other colleagues require them to do, or actually what the person understands of their role. Feelings of low appreciation and also feelings of being overlooked for promotion. So the outcomes of work-related stress can be a low morale and productivity, increased levels of absenteeism, high staff turnover and a poor safety performance. So, what's happening within our trust? The trust brief of 2012. So the trust brief is a yearly summary of the trust performance against targets in regard to our financial status, patient care and staffing. With sickness, 19% of total sickness of the trust was attributed to stress or anxiety. This amounts to 5,342 days lost due to stress and anxiety. Division B, in which occupational therapy is situated, unfortunately I don't have the breakdown of the percentage of sickness which was attributed to stress and anxiety, but the sickness rate is 4.1%. with a target of 4%, so we were target 3%, so there were 1.1% over target. And the staff turnover rate was 13.8%, which was 1.8% over target. So sickness and turnover are, again, above target and are outcomes of work-related stress. Now, the NHS Staff Survey of 2012. Now, the NHS Staff Survey is a national survey which looks at 38 key areas, such as staff's opinions of their personal development, their opinions of their managers, the opinions of the health and safety and well-being in their working environment. And these results are compared with other NHS trusts. Our trust had a response rate of 43%, which was in the lowest 20%, and of the 38 findings, 11 were in the worst 20%, 20 were worse than average, and 4 had improved. So what was in the worst 20%? Examples include Staff's opinions that the working environment impact on their health and well-being, on their ability to perform work or additional activities, that there was poor effective team working, that staff were witnessing many errors, near misses or incidents, that there's poor communication between senior management and staff, and that staff had a high intention to leave. Yes, it had improved with a number of staff appraisals completed and an improved effectiveness of reporting errors, near misses or incidents. But the ones in the worst 20% are examples of outcomes of work-related stress. Staff engagement is also measured in the NHS staff survey. Staff engagement for our trust was in the lowest 20%. The main areas of engagement which were scored low included staff ability to contribute towards improvements at work, staff's recommendation for a place to work or be treated, and staff motivation at work. Now, poor staff engagement is a factor linked to high work-related stress. So as a trust, we have got legal responsibilities. We have got responsibilities under the Health and Safety at Work Act of 1974 to ensure the health and safety and welfare of our employees, and this includes minimising the risk of stress-related illness or injury to our employees. Also, the Management of Health and Safety at Work regulations of 1999 make sure that we do make suitable assessments of risk to the health and safety of our employees, and to ensure we have measures in place to avoid risks as is reasonably practical. To also help us, the Health and Safety Executive have devised management standards for work-related stress, and this is designed to assist us in identifying the causes of stress in the workplace and to assist us to develop and implement solutions to minimise the effects. There are 6 standards in total, which we'll quickly go through, which are demands, control, support, relationships, role, and change. So, as a trust, if we have got some tools in place, which we have got the Trust Policy and Procedure of Stress Management, which is a TPP 410. We have got a risk assessment of stress, which is an assessment which is completed on a yearly basis by management. There is a stress toolkit which gives guidance for managers for helping people who have identified stresses in the environment or have identified that they are experiencing stress or have been off on sick. This is a guide to help managers deal with stress at work. And there's also a leaflet on stress management which provides information on stress, symptoms, personal stress management tips and links to additional information. So if we have got all these tools in place, why is staff turnover high? Why is absenteeism high? And why is engagement so low? What is going wrong? I don't know, but is it that the trust is identifying stress in employees only after they've been off sick? Is the trust addressing individual employee stress rather than the cause of stress? Is the occupational therapy department carrying out risk assessment to identify stress factors which are timely and effective at managing stress factors? So what could possibly be the stresses in the occupational therapy department? Well, demand could be a huge one. The speciality teams have no control over the number of referrals received. The number of referrals may well exceed the team capacity due to vacancy or loss of post due to budget cuts and general annual leave. And also teams are a mixture of static and rotational staff. And rotational staff move between the specialities every 6 months. So what of these demands can cause stress? So it would lead to a varying and unpredictable workload and pattern. There would be an increased training and supervision time need between the senior staff and rotational staff, especially at the early stage of rotation. This in turn will reduce clinical time available to be treating and seeing every patient referred to occupational therapy. In turn, increased workload for other staff members during the early stage of rotation or on reduced staff numbers due to annual leave or sickness. The rotational staff may well feel incapable of managing caseload, especially early on rotation. And you also have a very fluctuating skill and knowledge level within the team, and referrals may well exceed ability at some points in time. What else could be causing stress? Well, the control side of management standards. So the pace of work is very much influenced by bed pressures in the hospital, caseload and other agencies. There is no control over the complexity of referrals received, and there is no control over staffing, sickness or reasons for reduced team numbers, and the teams do just need to absorb all of these reduced staffing levels but still see the same amount of patients. So the control stresses, what could they be? So the reduced ability to plan the working day, and your priorities change depending on bed pressures, new referrals or your health of your patients. You may well plan to see a patient who then becomes too unwell, so you've got to change your plan for the day. Knowledge base is reduced at the start of rotation. There is a slower treatment process and therefore less referrals are being seen. And structured breaks for rest may well be missed and longer hours works if the team has got a high demand required of them. So what are the risks? Just to recap, again, we're looking at reduced employee commitment to work, reduced performance and productivity, increased accidents caused by human error, and reduced staff recruitment and retention. And all of the above were listed in the NHS staff survey as being in the bottom 20% for our trust. So what can be done to improve this situation? So the strategy I propose is to use the management standards to address any stresses during the supervision process. So to incorporate the management standards into the supervision process, this is to ensure supervision or personal development sessions are completed on a regular basis, and each time to address all of the management standards during regular supervision, and to act on supervisees' concerns or recommendations, and if things cannot be resolved within the team and improved, to raise concerns with the manager. So the aims of the strategy: I'd like to increase employee knowledge of stresses, to increase communication of stresses which may well lead to stress-related problems, and to nip them in the bud before they actually become a stress problem, to identify common stresses and work towards better systems to avoid them in the first place. And systems may well include additional training for supervisors on stress and stress management, developing different training methods depending on what supervisees are, asking for or finding difficult. Are training methods meeting their demands? Identifying any common training needs. Increase clinical support in the first few weeks as required. This was variable from each employee. And triaging referrals to manage the complexity, spread the complex patients amongst the staff so everyone has an equal measure of complex patients. Ensure adequate breaks and monitoring hours worked, and to complete risk assessments more frequently or as required rather than just on a yearly basis. So the potential outcomes of this strategy: we're looking for a healthier working environment, we're looking at reduced sickness absence due to stress and anxiety, we're looking for greater productivity, looking for reduced staff turnover, improved communication between employees and management, and to reduce errors, near misses or incidents. So is this strategy measurable? Yes. The NHS staff survey results, we would aim to have less key areas in the bottom 20% and to have an increased staff engagement score. Also, the trust brief results, staff sickness and staff turnover within trust targets should be achieved if this is successful. So sometimes we just need a little bit of inspiration. And thank you for listening to my presentation.